What about the importance of what we refer to as the therapeutic alliance in chronic health problems, stress, illness, trauma, and somatic therapy? I think it's really important to understand that I view this as a relationship, a complete sort of equality. Obviously, I bring some experience and skills and things, and you bring you. And it's really important for many people to meet and really feel an equality in that. And that's something that I feel we emphasize. But it's also, I think, clear that we must articulate expectations and hopes. And some people come in and go, well, I just want you to wave a magic wand and all this go away in one session. Well, I'm really sorry to tell you that that has never happened for me in over 30 years of working with people. So it just doesn't happen. And of course, the longer that we've had something and the more complex it is, the longer it takes. I've had somebody only yesterday who, after the first session, literally the dizziness disappeared, but there is still a lot more work to do. So I think I will certainly share on the first appointment how long I think something might take. And that could be months of work, literally months of work for some individuals. And I appreciate that's a huge investment. And sometimes that's too difficult for people financially. Well, we'll do the best that we can. But please, I think if we're going to embark on a journey of healing, let's just be really honest and upfront about realistic timeframes. And it's probably potentially more damaging to commence something that we don't feel that we can follow through. Not that we have to go on forever and ever. There may be a good point that you feel like that's enough for me now. That's okay. But we communicate that along the way. But certainly think, I certainly need to be planning 6 or 8 sessions in my head and seeing where we're going, and potentially 12 for this kind of work. So that's a good idea. And then we take stock at that point and then look to decide if we choose to want to do some further work together. So I think making a commitment on time is often important, to have some regular time slots for people, because that can build some safe structure for them, and that's often important. So regularity, and we'll discuss the frequency of once a week, once a fortnight, once a month perhaps. Sometimes even having the same time slot allocated can be really important for people, and we can do that for you. And a commitment to turn up and a commitment for me to be present and to save that time for you and not take on other work that means that I can't provide that care for you. So there's an alliance here. And I just think it's important to articulate that and to come with that kind of expectation about how I see a relationship working.